Hi, Mark here from Natural Balance Therapies with another quick update. On Friday, quite late on Friday actually, the government updated its guidance on who can work. And the good news is there are now some limited circumstances in which other members of the Natural Balance team can work in addition to the osteopaths. What they've said is that if there is a medical reason and you work within a sort of clinical health environment, which clearly Natural Balance is, there are circumstances where we can work. They said it has to be for a medical reason. They haven't said exactly what that means, but I think it's fair and reasonable for us to interpret. For instance, if you go for a run and you're feeling a bit achy afterwards, that wouldn't count as a medical reason. However, if you pick up an injury and you're actually in pain, yes, that would. Another example might be that if you're feeling, oh, this is really stressful, again, stress that probably on its own wouldn't count as a medical reason, but if it's causing you anxiety, perhaps it's stopping you from sleeping or going about your day-to-day business, yeah, I would say that is a medical reason. So we do need to be very strict about why and when we actually treat as massage therapists. And because of that, our professional bodies have put out some quite strict guidelines that we will need to follow. So firstly, we need to treat a specific issue. It can't just be a general treatment, and it can't, be my back's a bit achy, and it can't be maintenance, unfortunately, even though we all know how important maintenance is. We can't do the normal weekly or monthly maintenance type treatments. So we need to treat a specific issue that has been identified. We also need to triage, which means that we need to do a consultation by phone or video beforehand to basically document and justify why we're seeing you face to face, and obviously to explore alternatives, remote forms of help. Because of this, we're changing the booking system so that it does now require you to give 24 hours notice to book, so we have that opportunity to do the consultation. Treatment lengths, you're not going to actually be booking a treatment length because basically we've been told we need to help you in as little time as possible, as little face-to-face time as possible. So in most circumstances, what that would mean is that treatments would take no more than 45 minutes. Clients would be required to wear masks throughout, and the therapist will be in full PPE, which in the majority of cases would mean also wearing gloves. So there's a lot to take in there, and but it is good news. It's good that we're getting recognition as people who can help take pressure off the NHS and also help with a lot of sort of soft tissue type issues, as well as stress, anxiety. More details will follow. At the moment, there's no change to the booking system, so there is only osteopathy available, so please give that consideration if your need is urgent. And hopefully within the next 24 hours, I'll come back with another update explaining who in the team is available and when, and we'll load obviously that information onto the booking system. All updates will be put on the website as well, so if you want an update or if you haven't heard from us, then as I say, if you go to the website, you'll be able to see the latest situation there. Anyway, positive news, and take care.